Hi, my name is Ashley, and I'm a counselor. I work a lot with children and teens who are experiencing anxiety. While COVID-19 has been going on, we have seen an increase in how much stress and how much anxiety children and teens are experiencing. The purpose of this video is to talk over some different behaviors that you might be seeing in your child or in your teen, as well as some different things that you can do to support them in coping.
There are a number of behaviors that you may be seeing your child or your teen exhibiting that could indicate that they are experiencing more anxiety or stress than usual. You may notice that your child or your teen is crying more often. They may also be crying more intensely or crying over things that previously would not have been upsetting to them. You may be seeing an increase in tantrum behaviors or tantrum-like behaviors. These can include yelling, screaming, kicking, throwing things, slamming things, or just other behaviors that we typically see when children are expressing upset. Sometimes you will notice that a child who has stopped displaying tantrum behaviors will start displaying tantrum behaviors again, or you may just see an increase in overall how often these behaviors are happening or how long they are lasting or how intense they are feeling. Sometimes you might also notice that when a child or a teen is experiencing an increase in stress or anxiety, the tantrum behaviors may seem like they are harder to help redirect. Often, when stress and anxiety increases, people experience difficulty sleeping. For kids and teens, this could be difficulty falling asleep, or it could be difficulty staying asleep. Sometimes they will also complain of increased bad dreams or nightmares, either having them or having them more often. You may also notice that if you have more than one child, that they may be having a harder time in getting along. There may be more fighting, or there might be some more difficulty in working out situations that they previously would have been able to figure out on their own. You may also be seeing that your child or teen stops wanting to do things that they usually like to do, or may seem to lose interest in things that they're usually interested in or that they usually find fun. Especially with younger children or school-age children, you may see that they're going to start asking a lot of questions. Teenagers do this too sometimes. Teenage questions are probably going to be more directed, relating to specific things that they are worried or concerned about. With young children, you may just see an increase in asking questions overall. Especially in young children whose language is play, you may notice that their themes of play are related to being sick, being isolated, or dying. For young children who don't have fully developed language skills yet, they don't have words to express what they're experiencing or to be able to process what's going on for them. So they use play for this. So if you notice that your child is playing the same thing over and over again with their toys, this could be that they're just processing it, trying to figure it out, or it could be that they are looking for some help in understanding what's going on. Noticing what their demeanor is, their body language, their facial expression, what noises they are making, how loud they are being, and how intense the actions are they're taking in their game can kind of clue you in to see if this is a child processing or if this is a child that's expressing some upset and really needs your help. As humans grow and develop, we develop different behaviors, and it seems like we grow out of earlier behaviors that we had when we were younger. Regressive behaviors occur when children or teens experience an upset, including stress and anxiety. It looks like they return to a previous stage of development. So, for example, a child who was toilet trained may go back to having accidents, or a teenager who previously had wanted nothing to do with mom or dad may be seeking out a lot more comfort, either comforting words, or maybe they need a few more hugs, or just a little bit more time together with you. And finally, one of the behaviors that you may see are these repetitive playing the same things over and over again, or consistently wanting comfort objects or comfort foods. These are children and teens' attempts at being able to help themselves to self-soothe or to figure out what's going on, and be able to kind of help themselves to feel better, alleviating some of that stress and anxiety that they're experiencing.
The important thing to remember about all of the behaviors that we have just talked about are that they are ways of your child and your teen letting you know that there are some things going on that they may need some support in processing and in coping with. There are things that you can do to help support your child and teen in dealing with stress and anxiety. Let's take a look at some of those.
The best things that you can do to help your children of any age to be able to navigate through this challenging time is to establish a routine that you maintain consistently, including in your routine a sleep schedule, healthy eating choices, having free play or free time, physical activity, and maintaining social connections. Remember that a routine is something that you do consistently, but it's okay to have some flexibility to it as well. Make sure that your kids and teens are engaging in physical activity at least once a day. This can include going for walks or bike rides, playing active games like tag, or doing yoga and stretching.
Another thing that you can do is make sure that your child and your teen are getting outside on a daily basis for at least a little bit of time. Being outside helps support mental health. Getting fresh air and being able to move around or just enjoy different sights and sounds of being outside all help us manage stress and anxiety. So make sure that you are getting time outside, ideally again on a daily basis, but if not on a daily basis, just as much as you possibly can.
There are several different emotional coping skills that can really help when people are experiencing stress and anxiety. There are several different breathing strategies that can be really helpful with coping with stress and anxiety. They include just a basic belly breath, where you inhale deeply and fully through your nose, sending the air all the way down into your belly, and then slowly exhaling out through your mouth. Square breathing is where you breathe in for a count of 4, hold for a count of 4, breathe out to a count of 4, hold for a count of 4, and then repeat. In directed breathing, you breathe in through your nose and out through your mouth, and you concentrate on sending that breath to a particular part of your body. This could be a place where you're noticing that you're experiencing some tension or some soreness, or it could be just deciding that you're going to breathe in to your chest for several breaths and then breathe fully into your belly for several breaths. Whichever breathing strategy you use, the name of the game is going slowly, because when we slow our breathing down, we send messages to our brain that things are okay and that we're safe to calm down. When we need to calm down from stress or anxiety, the goal is slow and rhythmic. Grounding strategies are strategies where we use our 5 basic senses to ground our thoughts and our attention in the present moment. By paying attention to the information that our senses are sending to our brain, we're able to really fully and completely focus on the present moment and what is occurring around us. This helps our brain to redirect itself away from thoughts that are triggering anxiety. It also gives our body a chance to slow down and calm itself down. There are several different ways to use grounding. A strategy that tends to work really well for children and for teens is to focus on 5 things that you see, 4 things that you hear, 3 things that you physically feel, 2 things that you smell, and 1 thing that you taste. Progressive muscle relaxation is the process of slowly, rhythmically, and intentionally creating tension within muscle groups, holding that tension, and then releasing it. There are several different ways to do this, and there are lots of really great guided progressive muscle relaxation scripts and videos that are out there. Check out YouTube for some great ideas, or you can Google progressive muscle relaxation for children to get some scripts that are age and developmentally appropriate. Emotion words are really important. This is the language that helps us be able to express how we're feeling and what we need in order to be okay. Model using these emotion words yourself by saying, I feel whatever emotion you're feeling, and I need whatever you're needing. Help your children to learn what these words mean, what the experience of these emotions are, and how to use them. Having a language of emotion words helps children to be able to communicate with you to let you know what's going on for them. It's also really important to maintain your children's social connections. Right now, social distancing that we're talking about often is really physical distancing. While you do need to keep some separation with your children and teens from other people in order to keep everyone safe and help reduce the spread of COVID-19, you do want to maintain the connections that children and teens have with their friends and their peers. There are a number of different ways to do this, and you may have to get creative. Another really important thing to do is to help kids and teens understand that this is not something that's going to last forever, even though it feels like it is. Remember that kids' perspectives of time are very different from an adult's. Like so many things these days, there is an app for that. Apps that can be really helpful right now are apps that include guided meditation. Some really great ones to check out include Headspace or Calm. There are also some great guided meditations on YouTube, and nature sounds can also be really calming. Putting on different nature sounds that your child or teen finds calming can be really helpful at bedtime. It can also be really helpful to encourage them just to listen to the sounds and focus on their breathing. Make sure that you're spending quality time with your kids and your teenagers doing things that are fun for them. This could include imagination games, playing outside, riding bikes, could also include inside activities like drawing or making any kind of creative crafts. You can also spend time listening to music or watching movies. The quality time that you spend together with your children and your teenagers helps to strengthen your relationship. The quality of that relationship is super important to help your child and your teen feel safe and also feel like they can come to you to talk about things that are bothering them. Whatever emotions your child or teen are expressing to you, make sure that you validate their feelings. All emotions are okay, even the ones that feel uncomfortable. It's the behaviors and the actions that sometimes go along with these emotions that can be not okay. For example, if someone is feeling angry, the angry feeling is totally fine. It's okay to feel angry. It's not okay to hit or kick or destroy property. It's the behavior that's not okay. The emotion is okay. Let them know that however they are feeling is understandable and is okay to feel that way. This is going to be really helpful for your children and your teens in letting them understand both their emotional experiences in general, as well as the emotions they're experiencing related to COVID-19 and establishing a new normal. This is a stressful and a difficult time for everybody. For kids and teens, they have a hard time right now because there's a lot of information that they just don't understand. By validating their emotions, you're helping them to know that they are okay and that things are going to be okay. One of the most important things that you can do for your child or your teen right now is to let them know that they are not alone. This means that you let them know that you are there for them. But it also means that you're letting them know that their experiences are not unique with this. There are other kids and other teens, as well as other community members who are feeling the same way and experiencing the same things. This is called the principle of universality, and it's a really important tool in helping us to remember to gain perspective of experiences. Sometimes we get stuck in our own experience and we forget that there are other people that are going through the same thing. Feeling like we are alone enhances feelings of stress and anxiety. Feeling like we are not alone helps us to reduce stress and anxiety. One of the big difficulties with stress or anxiety is that it makes us feel as though we are unsafe, like something bad is going to happen. So to counter that for kids and teens, we help them to know that they are safe. We do this by having conversations about safety. Talk to your kids about who keeps them safe. Include community members in this discussion as well as people that live in your own home. Answer their questions in developmentally appropriate ways. The questions that your children and your teens ask you are going to communicate to you what's going on in their experiences and what's bothering them. By answering their questions, you're making sure that you're helping them to feel safe. What you tell a toddler or a young child is going to be very different from what you tell a teenager. Remember their developmental stage and make sure that you're sharing information that's helpful and not too advanced. There are some behaviors to watch for beyond the behaviors that we talked about at the beginning of this video that would indicate to you that your child or teen is in need of some professional support. If you notice that your child or teen is making statements about wanting to kill themselves or wanting to hurt themselves, or has actually made a suicide attempt, or has engaged in self-harm behaviors such as cutting, this is an indication that your child or teen needs some immediate help. You may notice a loss of interest in multiple activities that your child or your teen usually enjoys, and you'll notice that this is consistent and sustained for 2 weeks or more. If separation anxiety that is sustained consistently for 2 weeks or more is out of the ordinary for your child or teen or is more intense than usual. If your child or teen is having difficulty falling or staying asleep more nights than not, and that this is sustained for 2 weeks or more. You may also notice that your child or teen is presenting hypervigilance about germs. Hypervigilance is different from vigilance. Vigilance is paying attention to things that could harm us, and being cautious and careful in keeping ourselves safe. Vigilance right now, for example, is wearing personal protective equipment such as masks or gloves, washing our hands frequently, and maintaining physical distance. These are the things that we are doing to help keep ourselves and our families and communities safe. Hypervigilance is where the act of doing this is something that becomes obsessive, and we become so fearful that we could come in contact with germs that we are unable to do things that we need to do or unable to do things that we want to do. If you notice this behavior in your child or teen and it is sustained for 2 weeks or more, this is an indication that your child or your teen is in need of some additional support from what you can provide.
Thank you so much for watching this video on helping children and teens to cope with anxiety and stress related to COVID-19 and adjusting to a new normal. I hope that it's been useful information for you. If you'd like to see more, click subscribe to receive notifications for when new videos are posted.